Hello, this is Alexandra from California Health Collaborative, the maternal wellness programs. Today we have Tivoli Walker, who oversees SISTA Coach in San Joaquin County. We're going to discuss African American disparities in maternal mental health, and then we'll follow up with any questions and answers. So Tivoli, do you want to go ahead and present?
Sure, thank you.
And if you want to provide them any background of you and your experience.
So my name is Tivoli Walker. I am with the SISTA Coach Program with the California Health Collaborative. It is part of the Perinatal Equity Initiative, and it is to reduce Black infant mortality rates and improve the health of our birthing Black people and their babies. So I'm going to talk about maternal mental health and how it affects people in general, especially Black mothers. So hopefully,
Before we get started, do you want to do a slideshow?
Yes, I'm gonna, but I can't see you when I do it, so that's why. You could see it, right? Okay. You can still see it? Okay, great. So perinatal mood and anxiety disorder, also known as PMAD for short, is a term used to describe a spectrum of disorders that can affect mothers during and after a pregnancy. And the spectrum includes depression, anxiety, obsessive-compulsive disorder, post-traumatic stress disorder, bipolar, and psychosis. And it is the #1 complication of childbirth. It can occur during pregnancy and up to 1 to 2 years after birth or following the cessation of breastfeeding. Women in their childbearing years are the largest group of Americans with depression, and over 55% of ever depressed women have their first episode of depression during their first postpartum year. And it's more common in first pregnancies, but can develop in subsequent pregnancies as well. And then women dealing with grief or loss due to miscarriage, stillborn, or loss of a loved one are at higher risk of maternal depression. Excuse me if you hear my kids in the background, it's homeschool day. So studies have shown that certain hormonal deficiencies can affect mental health. Reproductive hormones such as progesterone, estrogen, and testosterone influence brain nerve cells and may protect against memory or cognition loss. And then after childbirth, the drop in progesterone levels is also linked to postpartum depression. So you can see on this chart how the progesterone and estrogen go up during the pregnancy, and then immediately after delivery, it starts to tank. And so that can affect, and it's linked to postpartum depression. So some symptoms of PMAD, which may differ by culture, are crying more often than usual, feelings of anger, withdrawing from loved ones, feeling numb or disconnected from the baby, and significant changes in appetite and sleep, poor concentration, feeling overwhelmed, feeling guilt about not being a good mom, loss of energy, hopelessness, irritability, and persistent sadness and anxiety. And symptoms of post-traumatic stress disorder can include intrusive re-experiencing of a past traumatic event, isolation from family and friends, impaired mother-infant bonding, feeling cheated by staff or hospital care, which is a big issue among our Black birthing people. They often don't feel heard. They often feel neglected. They often are made to feel like they don't know what's going on with their body. And so that's a big issue. And with obsessive compulsive disorders, mothers can experience either obsessions or compulsions. And obsessions are reoccurring thoughts, persistent thoughts, impulses that may be intrusive thoughts, such as baby drowning, baby falling and damaging head, and harming the baby or oneself. And then the compulsions are repetitive behaviors or mental acts which are performed, like rigid rules, hand washing, changing infant diapers, constant checking if baby is alive and breathing. And then you often hear about baby blues, but there's a difference between baby blues and PMAD, because baby blues, 50 to 80% of women in diverse cultures will experience baby blues, and it peaks 3 to 5 days, and it usually lasts about 2 weeks after delivery. And then the range of emotions are due to hormones fluctuating and the body and mind trying to regulate back to its normal state. So the mother could feel sad, mad, worried, overwhelmed. Often they're sleep deprived and tired. So sleep is important during the first 6 weeks after delivery because it can result in a quicker recovery. And now with PMAD, the mother would be experience irritability, significant changes in appetite and sleep, poor concentration, feeling overwhelmed, persistent sadness and anxiety, and in rare cases, suicidal thoughts or reoccurring thoughts of death. And that goes well past 2 weeks after the birth of the delivery. And it can also be during pregnancy. So who is at risk of PMAD? So if you have a personal or family history of depression, anxiety, OCD, bipolar disorder, and eating disorders, and some symptoms of depression like sadness, unexplained crying, lack interest or feelings towards babies, inability to take care of self or the family, mood swings, overwhelmed or isolated, and then the symptoms of panic and anxiety panic attacks, excuse me, agitated, inability to stay still, constant worrying, racing thoughts, shortness of breath, heart palpitations, and episodes of extreme anxiety, fear of dying, going crazy, or fear of losing control. So PMAD and Black women. Black women are twice as likely as whites to suffer from perinatal mood anxiety disorder, such as postpartum depression, and less likely to receive treatment. And then close to 40% of Black mothers will suffer from postpartum depression, which is more than double the rate for the general population. And it's because of factors like socioeconomic status and systemic racism play a role in why women of color are more likely to suffer. And this includes lack of access to high quality medical care, higher risk of pregnancy and childbirth complications, lack of social support, gaps in medical insurance, financial barriers, including lack of paid time off from work, unsafe neighborhoods, increased stress, exposure to trauma, and it's not on here, but preterm birth as well. And so typically Black women don't seek help because they fear their children being taken away. And there are studies that show that social services, people who work in social services do often view Black mothers as less capable. And there's also a stigma in mental health in the Black community, which we're trying to change that. And there's partner or family discord and just not being understood. And also, as a Black woman myself, we often deal with, the strong Black woman mentality, or, just push through. You'll get through this. And then, before you know it, you're like falling apart. So we should care because short-term illness lasts from 1 to 6 months if treated versus chronic illness. And we want to increase awareness so we can normalize a healthy mental state. And we need to put the tools to cope in our community, the tools to help someone, and create support systems that will reduce the stigma and reduce suicide and psychosis. And although considered mainly as a problem of the developing world, maternal mortality and morbidity remain a challenge in the United States. The US has the highest rate of maternal mortality among developed nations, and is steadily rising since the past 40 years. Reported pregnancy-related deaths in the U.S. increased from 7.2 deaths per 100,000 live births in 1987 to 17.3 deaths per 100,000 live births in 2017. And 2 out of 3 pregnancy-related deaths occur outside of the day of delivery or a week postpartum. And the leading cause of pregnancy-related deaths vary by race and ethnicity, but Black mothers are almost 3 times as likely to die in childbirth compared to other racial and ethnic groups. And also, it's important to note that the maternal mortality rate for women age 40 and over is nearly 8 times that for women under age 25. Adolescent mothers also can have a higher risk of having postpartum depression. And about 1/2 of adolescent mothers experience depression symptoms in their early postpartum period. Teen pregnancy can lead to untreated depression, and which leads to subsequent pregnancies, social isolation, low maternal self-efficacy, family conflict of multiple families living in the home, parenting styles, stress with parents. The teen is the mom, but grandma wants to raise the baby how grandma wants to raise a baby. History of physical and or sexual abuse, and interference with the developmental task of adolescence. And depressed or anxious mothers tend to show less positive face interaction with infants, and they tend to show more negative faces towards the infant. And then the infant is affected because they behave in a depressed style, whether interacting with the depressed mother or a non-depressed adult. And there are risk factors for the infant with the depressed mom, and that can increase risk of breastfeeding complications, increased risk of infant neglect and poor mother-infant bonding, increased risk of poor infant cognitive development, increased risk of behavioral implications, increased risk of adverse childhood experience, abortion or adoption, and rates of infanticide. And then as far as the economic impact, untreated maternal mental health conditions is estimated to be about $22,500 per mother. During 2017 to 2019, in San Joaquin County, preterm birth rate were the highest for Black infants at 12.6%. In the United States, prematurity, low birth weights, is the second leading cause of all infant deaths during the first year of life, and the leading cause of infant deaths among Black infants. And you can see preterm is less than 37 weeks of pregnancy. So we have the Black infants and the American Indians. The preterm birth can be due to the mother. Oftentimes, Black women get late prenatal care, and they have more stress. And for NICU parents, mothers and fathers of neonatal intensive care unit infants are impacted by the psychological factors. They're often concerned about the long-term outcome or the survival of the infant, being separated from the infant. The mom is fine, so she gets to go home, but the baby has to stay for however long, months sometimes. And then they have an altered parental experience. They don't get to take the baby home and bond with it. And they feel limited about their ability to care for their infant. And they often feel helpless. And NICU mothers will tend to feel lost in carrying out the maternal role. And this has been identified as one of the most significant contributors to depressive symptoms. And mothers will have difficulty developing perceptions of their role, resulting in a higher risk of distress, anxiety, and or depression. So it's shown that early treatment and comprehensive treatment, early intervention and comprehensive treatment can help with PMAD. Sorry, my daughter is yelling and it's driving me crazy. Counseling. So you talking with the psychologist or counselor can address topics such as changes in communications, role relationships, and responsibilities. And the therapeutic goals is to have a shift in identity, realistic expectations, increasing verbal communication, conflict resolution, anger management, and decreased feelings of grief. And then there are some treatment options, pharmacotherapy, such as antidepressants and or anti-anxiety medications, prescribed by either the OBGYN during pregnancy and postpartum, and then after that, it's usually the primary care provider or psychiatrist would be recommended. And if pregnant or breastfeeding, there are selective serotonin reuptake inhibitors. And those are a class of drugs that are typically used as antidepressants in the treatment of major depressive disorders and anxiety disorders. And for us, so there are PMAD support groups that are shown to be helpful. And for us in our county with our SISTA Coach Program, we will be launching a PMAD support group. It's a 6 weekly sessions. It'll be through Zoom, and it is a max of 10 people, and it's going to start May 26th, which is next Wednesday, and it's from 4 to 5:30. And we'll have topics such as the birth of a mother, how to adjust as a mother, getting past that mom guilt or not being the perfect mother, whatever that means, right? And then understanding postpartum depression and anxiety, because a lot of times they may not even be aware that they're depressed or anxious. It may just be a normal state, depending on their past traumas or past experiences. And then cognitive behavioral therapy coping skills, which are very good skills to use to change those behaviors and recognize things and what to do in certain instances, such as like if you're feeling anxious, just take a minute and breathe, and telling yourself, okay, what am I feeling, and being okay with feeling that anger and letting that anger come and go, and then moving on from that instead of trying to suppress the anger and making you more angry. So we covered things like that. And so how you can make a difference. So you want to understand your unique role and obtain an understanding of perinatal mental health, as well as perinatal loss and grief. And you want to obtain an understanding of trauma related to pregnancy or birth experiences, and develop help develop and implement policies and procedures for the referral system if you work in this field and while working with perinatal families. We also have a maternal wellness collaborative of California, and the mission statement is to support whole person wellness for women and their families affected by mood disorders within California through an integrative model of care. And our vision is for women and their families in California to have healthy perinatal outcomes through access to quality resources and supportive network. And our scope of work for 21-22 is focused on infant loss and mental health. And it's statewide, and we have partners such as hospitals, insurance reps, First Five, and we're always recruiting in the counties to join the coalition. And this is my contact information if you want to know how you can be, if you want to be a part of this, work with the SISTA Coach or join the support group, feel free to contact me for any information, and I'll be happy to help you.
Thank you, Tivoli. That was great information. So let's just kind of talk about some of the information you provided, because you provided a wealth of information.
Mhm.
So we know that 1 in 5 women will suffer from a perinatal mood anxiety disorder, right? So that's out of all women who are pregnant or have given birth within the last year. So if we take that statistic and we add that to African American population, what are we really looking at? How many are really at risk? Right? So almost 1 in 2, according to the research, and that's of those who reported,
Right.
right? And so how does that impact the African American community overall if mom is not well?
Well, it has the whole trickle down effect. The infant is affected. If she has other children, they're affected. The whole family. It can create a environment that's not warm or
Right.
conducive to raising a healthy infant, a healthy baby, a healthy child,
Most
and
definitely
a healthy mom.
a healthy mom, right?
Hmm.
And so we oftentimes look at dis perinatal mood and anxiety disorders as an infant mom, issue, right? So let's say I just have a baby or I'm pregnant and then I have a 16-year-old that's acting out, right? So then that 16-year-old is going to be impacted.
Right. Hmm.
So it's a family system that overall is impacted,
Yes.
right?
Hmm.
And then you had shown a slide at the NICU. And so a baby who is preterm birth, which we know that in the Central Valley, we have really increased rates of preterm birth around among African American community. Now, what do you think the conversation might feel like or look like when we have a nurse who's explaining, what's happening with baby, and then you just delivered a baby? What could that look like or feel like for a mom?
Very overwhelming. Um, yeah, just overwhelming and just could cause a lot of anxiety. The mom's trying to adjust, especially with the tank and the hormones and all the body adjustments that go on right after birth, and and not being able to hold the baby, know if the baby's going to be okay. That could be a lot of pressure.
A lot of pressure.
Hmm.
And I always think about, some of us were raised that speaking up is not necessarily appropriate when we are speaking to doctors, right?
Hmm.
Um, and so I can just imagine what that would feel like. Not like
Hmm.
not having the knowledge base, but then being taught not to speak up or to challenge a doctor or to even have intense conversations, right?
Right.
So then that leaves you kind of wondering.
Hmm. Yes, definitely.
Mhm. So a new push is doulas, and how can that be a help among our African American community and just in perinatal mental health as well?
Yeah. So the doula can offer support. They have, full spectrum doulas that are there for you beginning, during birth, and postpartum. And they have some that are there, while you're pregnant and at birth, and then they'll have some just postpartum. But the doula can help you be your support, and
Mhm.
is for you and your partner, if their partner's there for the birth of your child, and they can help you with what to ask for. They can just hold your hand. They can just help guide you if they're more knowledge based.
Mhm.
If something, I think they provide a good sense of comfort and
Yeah,
just support, and yeah, like I said, they can just help guide you if need be.
yeah,
Even to the resources, if they don't know, they can find resources for you.
yeah, and I think they can help you be the voice, right?
Yes,
So
be the voice. That's what I
yeah,
was trying to say.
yeah. If you have a question, I remember when I had my 8-year-old, she's 8 now, so it's a little while ago. Um, the monitor, right? It kept going off. And so I didn't know what was going on. But had I had a doula there, she might have been able to explain that, okay, your baby is fine, right?
Hmm.
But it's their monitor that needs to be readjusted. And then I'm getting anxious because I know cognitively that if that monitor is beeping, there's something wrong with my baby, right?
Yes.
But
Hmm.
I can't, because I'm in such pain, I can't formulate that,
Right. Hmm.
right? And so, you provide us a lot of great information, but just typically speaking, families in our African American communities, what are some resources? Like, if I was to experience a perinatal mood anxiety disorder and I didn't feel confident in telling my doctor, um, going to a psychologist, therapist, who could I reach out to?
Well, in our county, we have the Black Infant Health Program,
Mhm.
and they have case management nurse case managers. And so I would think, if you have a local county Black Infant Health Program in your county, reaching out to them first, and maybe they can help support you and guide you to the right, seeking the right support group, or if you want to try therapy, therapy just seems in the Black community, I'm not crazy. So, start with the support group, maybe ease into the
Yeah.
therapy. So,
Yeah.
yeah.
And we can also ask for African American therapists too, which makes
Yes.
it feel a little bit more comfortable. So I want our moms and families to feel confident in asking for their needs, right?
Mm-hmm.
The other piece, and I always say, if you made it to our office, the psychologist or therapist office, there were other routes that you could have taken prior, hopefully. Not all the time, but sometimes. And I think of just like play groups. Like right now we have shelter in place, so there's not many play groups happening.
Mm-hmm.
But like a mommy and me group,
Yes.
or church,
Mm-hmm.
like a church, a women's group, right? And
Yes.
getting out of being isolated. What are
Mm-hmm.
your thoughts with that?
Yes, I agree. Church plays a big role in the Black community. The mommy and me groups. Also, we have a lot of churches. We have a couple of churches here that have like women's health groups, or a separate entity from, that focus on women's health. And so I think that's good. Also, here we have a coalition, part of our perinatal equity initiative, that they have a lot of different members, and we have, pastors on the coalition, we have therapists, we have other nonprofit organizations who work with the Black community. And so I just think that just getting the word out of knowing what's out there, and just telling someone if you're not feeling like yourself,
Like reaching
even though,
out for help.
yeah, even if it's to a close friend,
Yeah.
I
because
think that
people know people.
Yeah.
a big issue, I think, Tivoli, if I can ask, is just a big issue, when we speak of mental health, and is being comfortable seeking help, and asking those questions. And as you mentioned earlier, our African American community may have those self ties of, hey, I am strong Black women, and that may hinder them asking for help. So how can we, whether we're community members, whether we're just health advocates or providers, how can we amplify and support the voices of our Black mothers and families for them to seek help and those resources?
Yeah, I would say if you, are out in the community, and you oftentimes, like, we've lost that sense of like community. Like when I was growing up, if I was acting out, this lady can tell me, hey, don't do that, in a respectful way, not like grab me up or anything. But now it's like you say something to someone's child and the mom is like, don't speak to my child. But I would say we need to get back to, like, if you notice something, speak up.
Yeah.
Like if you notice a mom struggling or is just super agitated in the store, just try to, be there, even if you just don't tell them to calm down. One, that never works. But just, or, if you see pamphlets or something, just keep them in your purse or your car or something, and you can hand them out if you are, you may have a church member or someone you see that, a neighbor or something that's struggling, and you're like, oh, I came across this pamphlet you may find useful. I just think sharing information.
I love how you said speak up. I have daughters that are close in age. They're about 2 years apart. And I can recall, just being in Target and people just staring at you like, and one's acting out, one's running down the aisle, right? And the other one, oh my goodness. But really just being there to support them. Like, oh, how can I help you? Or
Yep.
kind of hard with COVID now. So you don't ask someone, do you want me to hold your baby? But sometimes they're willing, right? Because what else are you going to do when you have a toddler running down the aisle? And then
Right.
Right.
Yes.
Just engaging and acknowledging, or when a baby is crying, right? be there with the mom. Like, you know, I've been there, right? 'Cause it's embarrassing sometimes.
Yep. I remember I was in the store and I had 1, 2, and 3-year-old. So the 1-year-old was in the basket and my boys were hanging on the side, but they were on both sides. So my husband and I turned around to look at something and they pulled the cart over and we turned around and the cart's on top of the boys, but no one stopped to help or asked if they were okay.
Yeah.
Like, I just, like, we need to get back to caring.
Yeah.
Don't be afraid to approach.
Mhm. Yeah.
Even just saying
Okay.
something simple, you know, like, hey,
Yeah.
like, hey, little buddy, like,
Yeah.
you know, like, have a good day. Like, that's something that, you know, doesn't imply too much pressure on the mom, as
Mhm.
maybe, you know, like maybe we want to hold that child, but it's like, are we sure if she's comfortable? And that
Mhm.
can kind of be an easy way to kind of, you know, start that
Yeah.
interaction with mom.
Yeah,
Mhm. Yeah.
that's how you know if they're comfortable or not to talk to you. They'll start talking.
Yeah.
Yeah, and it's really just engaging because when we walk into stores, there's already this stigma, right? It's already this feeling like, okay, you know, what's gonna happen when I get into the store? So then when we have a child that acts out, it's like this added pressure, right? So how do we then diffuse some of that?
Yeah.
Mhm.
And Tivoli, in your experience working with our African American mom, can you kind of give us like an insight into how to be culturally sensitive when talking to them, especially for our providers?
Mhm.
I love how your program, you know, educates the moms to speak up when they're with their providers, and you know, if there's bias, speak up. If they're educated and they're able to ask questions, it'll help them out in the long run. So can you give us some insight in how we can become culturally sensitive?
I would just say, just listen to the mom.
Mhm.
Like, there was I have a Facebook friend that shared a story that she was having her 3rd baby and she dilates slowly in the beginning, but once it starts, it starts. So they tried to send her home and she kept saying, you know, you're going to send me home and I'm going to have this baby at home. And they're like, sorry, we can't help you. And then they sent her home. What happened? She had the baby basically in the ambulance.
Oh,
So just, you know, this is not her first rodeo, you know, just listen to the moms, you know,
Yeah.
and just try to, you know, use, you know, interpersonal communication skills, repeat back what they're saying to you. And, you know, so, you know, like if they're telling you something, just don't dismiss it, you know, say, okay, so you're feeling X, Y, and Z. So typically that's normal, but, you know, I can do X, Y, just don't dismiss it.
Yeah. I always think like if they're speaking up, it's for a reason. Like it does not hurt to check.
Right.
If it makes them like be at peace, it doesn't hurt to check, you know?
Yeah.
I think as women, we know our bodies, right? For
Mhm.
example, I know it's going to take me 24 hours to have a baby. Doesn't matter when and where, but that's how it's going to happen. And so I think that we need to speak up and say what our needs are, and it's okay to say what our needs are, right?
Yep. Yeah, exactly. And I have a mother who I don't know if it's different now, but when I was having children, towards the end, you would when your weekly visit, you would get checked to see if you're dilated. Well, they weren't doing that. And she's like, the baby's feeling low. I'm feeling a lot of pressure. And she just wouldn't check me. And I said, well, next time you go, ask to see another provider or demand to be checked, you know, like you have that right. So, and then so she went and then she said they checked her and then they even, you know, stripped her membranes and everything. And then she had the baby like 4 days later.
Yeah. And feel confident in speaking up.
Yes. And she felt
You know,
confident.
more than one child. I mean, by then you know.
Yeah.
So we're getting to the end, but let's just talk about breastfeeding quickly in the African American community and how's that perceived, and then how is that connected to mental wellness?
There is like I noticed that there is a low rate of breastfeeding, and we do have a Black lactation consultant here and we have Flourishing Families, which is a nonprofit, and they really promote breastfeeding, and we're just trying to make it a normal thing again, like it's the best milk for the baby. And I know a lot of my younger moms are like automatically like, absolutely not, and then I had one who tried, and it was difficult, but she tried and tried, and she finally gave the baby a bottle, but at least she tried. And so I just think we just have to get the messaging out about breastfeeding and normalizing it and making it known that that's healthiest for the baby. And, to try to work with our older community. Like for me, when I tried, my mom, I love her to death, but her and my mother-in-law was like, oh, just give the baby a bottle so I can hold him, and it's so tempting when you're exhausted and
it's painful.
Yes, and it hurts, and you're just like, oh, if they can feed the baby, I can just go lay down, But, we need to teach grandma to, encourage it. So, yeah.
That's great. And so the other piece is sometimes breastfeeding can cause a lot of anxiety, right?
Yes.
It's not lacting. Maybe the family isn't very supportive. What are some ways or some things that mom can do for herself to kind of decrease some of that anxiety?
I would think just to just be easy on herself, and babies cry. Babies cry. If babies crying are, if they're not having the amount of wet diapers, then, be concerned. But if they're having, the amount of wet diapers, but, they're crying because they seem hungry, they could be hungry, or it could just be comfort, and just be easy on yourself, and try to work with the lactation consultant or an experienced mom who breastfed, or breastfeeding educators.
Yeah, calling back the pediatrician.
Yes, call the pediatrician.
If it's ridiculously painful, there's resources. The one thing I think of is when I had my daughters, I had family members like touch her stomach and say, well, it's not hard. Well, I don't think it was supposed to be hard, right? But at that time, I'm like, okay, well, if you get the base formula, then it is hard, so maybe they're right. We just need to educate ourselves, right? And not go with what people are saying. And lots of resources now online, and their pediatricians, and is out there.
Yes.
Oh, okay. So guys, I had a quick question. I think talking about like how we can support our moms as a community, and as well right now, just kind of talking about our family support and kind of how, just how family might kind of play into that transition with breastfeeding, brings up another thing I think for me. So ideally we would all grow up in a really supportive, loving community, but we know that that's not really the reality, of some of our upbringing. So how could we maybe address that conversation about the intergenerational trauma in our Black mommies? I know it's a big question.
It's tough.
Yeah.
If you think about it.
Yeah. I would think just there's a lot of like resources and things like on YouTube, or just finding how sometimes in the Black community the older generation doesn't always want to listen to the younger generation. So I just think finding an authority like a pastor or a pastor's wife or something like that to help in those situations.
Yeah, and I'd only take it one step further, is almost creating your tribe prior to whatever, the experience is. For example, you might want to have this pastor or other female and male figures for that matter that can be your support as you're raising these children or as you're navigating your families. I always say, you know, you want to have a psychologist on board just like you have a pediatrician and a dentist, because you don't want to wait for a crisis to hit, right?
Right.
And you build a relationship with the pastor or the pastor's wife prior to, you know,
Right.
whatever issue it is, whether
Mhm.
maternal wellness or, I don't know, finances.
Yes. Mhm.
I love
And-
how like Tivoli keeps mentioning resources. That's how like I always think about it, just building resilience through education and resources.
Mhm.
Because unfortunately there is a lot of systematic structural racism and there's no way of avoiding it. But if you are resilient and you're educated, you can, you know, work your way around it.
Mhm. Yes.
I would agree. I would agree.
Ramona, I agree.
Tivoli, we have a question from our viewer. Question: as a community, what should we be mindful and how can we address issues of mental health in our African American community?
Can you read that one more time for us, Ramona?
Yes. It says, as a community, what should we be mindful of and how can we address issues in our African American community's mental health? I'm restating the question. I hope that's what they meant.
So I'll start and then you can jump
No,
in.
I was going to say, I'll let Alex take that one.
I think as providers, we need more African American providers. That's first and foremost, right? Like we need to encourage our young African American children to become doctors, psychologists, therapists, because that will help. We need to go into our school systems and educate, right? Educate about mental wellness. And we don't want to go back to adversity. So we don't want to always talk about trauma and anxiety and depression. We just want to talk about wellness. Like, how do you be well, right? And that's getting off the laptops, it's going outside, it's building community. And so I think that's first things first. Then we need to go into our churches and then talk about mental wellness, right? Talk about speaking up. And it's about, again, like Ramona had said, education, right? What are your thoughts, Tivoli?
Yes, I think all of that. Also, I think, you know, just having, you know, here we have a lot of, especially during the summer, we have a lot of like festivals and events like Juneteenth, and you have the vendors and the booths and the speakers and everything. And, you know, having those resources there at those events and just, and all of what you said, Alex.
Yeah, and it's going to take time, right?
Mhm.
The other thing that
Yes.
comes to mind is like literature. So books, like children's books.
Mhm.
Like we need more African American books that are, you know, talking about wellness.
Mhm. Yep.
Anything else, Ramona and Elizabeth?
Agreed. We have a lot of agrees from our viewers. So that's great, Tivoli.
Good. Okay, so Tivoli, do you want to tell them one more time how to contact you in San Joaquin County?
Sure. You can contact me. I'll put this back up so you can see it. I'm a visual person. Here is my contact information. And my phone number is 209-202-2640. And my email is twalker@healthcollaborative.org. And then our website, healthcollaborative.org, we're under the Maternal Wellness Program, and we're the San Joaquin County SISTA Coach.
Thank you so much, Tivoli. And then for our Fresno, Madera, and Kings perinatal programs, you can log on to California Health Collaborative. Thank you, Tivoli, Elizabeth, and Ramona. If there's no other questions, I think we're done.
Thank you. Also, you can find us on Facebook, SISTA Coach CHC. And so follow us there.
Nice.